I am absolutely delighted and thrilled to see so many of our contributors, our supporters, our partners. Today is certainly a day of celebration for the launch of the World Health Innovation Network. And of course, you can never launch anything without the phenomenal work and support of a team. And I believe I have the most outstanding team in the country. And the reason I know that is because they keep getting recruited all over the world for some incredible positions. Let me extend my heartfelt thanks who literally made today possible. Laurie Turek, our Executive Director, Rishi Jain, who I think is somewhere in the back, waving his hand, Director of Stakeholder Relations, and of course some incredible students that have come out of the Odette School of Business, a program and a group of students we are most proud of. Sarah Donnelly, who is here, I think, as well at the back, Erica Sanborn, our resident photographer, and one of our most recent, Betty Chang. Our team is absolutely been working tireless, and I think you'll, by the end of today, share with me as well our incredible thanks for their hard work. We're not only celebrating the launch of this World Health Innovation Network, we're actually celebrating some incredible news this morning, which is really a tribute to the leadership of our president, Dr. Alan Wildeman, who will join us in just a moment. University of Windsor has been named in the top world university rankings and have really zeroed in on the heart and soul of University of Windsor, which are the students, the diversity that they bring to a very, very rich learning environment, and one where faculty are given the opportunity to engage them in very real-world research and education, learning on the ground with preparing them for the world and shaping the world in front of them. We have a phenomenal environment to work in. I have been recruited back to Odette under the leadership at the time of Dr. Alan Conway. I am ever so grateful to, and who is with us today as well. So before we get too long and I get in trouble for taking up too much time, let me welcome our president, Dr. Alan Wildeman, who will be our host this morning. And on my very personally, Alan, thank you ever so much for making innovation at University of Windsor not only possible, but thriving. And believe me, innovation in healthcare is not for the faint of heart. It's really a tribute to your leadership that has made this possible. And our entire team is incredibly grateful for all you do. Thank you.
Thank you, Anne, and I want to welcome all of you here today. It's wonderful to see such a large crowd. Anne, you were too generous in your remarks about what my contributions to all of this have been. And I just want to say that the university, for the first time getting on the World University rankings, is the result of the work of a lot of people, alumni, students, staff, the community, everybody coming together. So I'm really happy to welcome all of you today for this very important launch of the World Health Innovation Network. And Anne, I want to congratulate you and all of your team for bringing this opportunity forward and deciding that Windsor is the place to do it. And that's really wonderful. For those of you who might not know, the University of Windsor did not pop up like a mushroom recently. It's been around about 150 plus years, beginning with Assumption University, and there's a very long tradition of post-secondary education in Windsor, Essex, and it's one that our university is founded upon, and it's one that continues to have a really large impact. For those of you who also would know, Windsor, Essex has been the source of tremendous economic activity for our country for a long, long time. We are really pleased that we're able to be here today to launch this really important project. And I'm not going to preempt any of the thunder that Anne and her team will be able to talk about later. But how we deal with health innovation and how we deal with the various supply chains that underpin it is something that she and her team and all the people working with her have recognized as being a huge opportunity for our province and our country. and it's one that we're very pleased to be able to support. It does speak to the commitment of the university to try to make a difference without a lot of pretense, and people know that studying supply chain management is not a pretense sort of laden endeavor. You kind of do it in the back rooms, and you do it by talking to the right people at the right time and doing what you have to do. I want to welcome those from Windsor who are here as well, and Dean Alan Conway, who's just now on administrative leave after concluding a very successful time as Dean of the Odette School of Business. Thank you for all of your support in helping to launch this as well. And Acting Dean Mitch Fields is here today, and he is continuing to carry the torch forward as we support this. The Advisory Council playing a very important role, making sure that, that we stay between the lines when we need to stay between the lines and remain focused on what we have to be focused on doing. And for all the various faculty and executives working with us, I thank all of you, and particularly I thank again all of you for being here. This is really wonderful for us. It's now my pleasure to introduce Martha Houston. Martha is one of our esteemed WIN Advisory Council members. She is Senior Vice President and General Manager of Services and Solutions at Cardinal Health, the leading solution provider for healthcare in the acute, long-term care, and alternate care markets. Prior to this role, Martha was President of Cardinal Health Canada. Martha has held executive leadership positions at Cardinal Health since 2005 in customer support, distribution, and operations in both the medical and pharmacy areas. Before joining Cardinal Health, she served in executive roles for Owens & Minor, with responsibility for sales and operations at the regional and national levels. She's held management positions in healthcare, banking, and insurance industries with experience in treasury management, internal audit, and public accounting. She received an executive MBA from the University of Iowa, a Bachelor of Arts in Business and Accounting from Simpson College, and also completed executive education programs in leadership and healthcare at the University of Virginia, Darden Graduate School, and the University of Michigan. Martha also holds the Certified Public Accountant designation, as well as that of Certified Internal Auditor. It's my pleasure to welcome and to introduce Martha Houston.
Good morning, and thank you, Dr. Wilderman, for the introduction. I'm so happy to be back in Canada and here today in two roles, as a member of the World Innovation Network Inaugural Advisory Council and as a representative of Cardinal Health. I know the rest of the members of the WIN Advisory Council are also excited to be part of this group. Here today are Donna Wellington, Vice President of Hospital Operations for Henry Ford Hospital, Carol Stephenson, Corporate Director for Manitoba Telecom Services, Intact Financial Services, Ballard Power Systems, and General Motors, Jody Butts, Executive Director for Rise Asset Development, Jim Marsh, President, WFT Investments, and Carolyn Cross, Chairman and CEO of Ondine Biomedical and Sinuwave Technologies Corporation. Our last two members were unfortunately unable to join us today. Bill Butt, who is a member of the Board of Directors and Chair of the Audit and Pension Committee for OMERS, and he's also chairperson for the St. Michael's Hospital President's Council, and Peter Vandervelden, Managing General Partner for Lumera Capital. I also want to acknowledge David Murphy, who is the current president of Cardinal Health Canada, Dwight Duncan, our esteemed guest speaker, and Dean Fields, as well as the many leaders in the healthcare sector and government officials who have joined us for this WIN launch event today. Like those of you in this room, at Cardinal Health, we understand the significant importance of a winning mission and vision. We are proud to be stakeholders that will partner to identify and promote innovative solutions to the challenges facing health systems. The impact that can be achieved by creating both the evidence and models to successfully scale and embed innovative technologies, products, and models of healthcare into health systems to achieve both value and economic growth for innovators is unlimited. And even more exciting, the opportunity to improve patient care and outcomes is the most compelling incentive and the ultimate goal, and is certainly core to the mission of Cardinal Health. Cardinal Health is a global healthcare services and products company that improves the cost effectiveness of healthcare. As the business behind healthcare, we help our customers focus on patient care while reducing cost, enhancing efficiency, and improving quality. We welcome the new challenges, we try to anticipate the trends, and bring support, speed, and vision to our customers and partners. And we truly believe the work of WIN will help us bring innovative solutions to the market. You know, I was privileged to work and live in Canada for 2 years as the president of Cardinal Health Canada, and I've had many questions from both sides of the border about the healthcare systems on the other side. And my response has always been the same. You know, the funding mechanisms may vary, the terms we use might be a bit different. What you call emerge, we call ER. What you call physio, we call PT. But the underlying challenges facing our systems are very much the same. The concerns that customers in Ontario have are the same concerns that our customers in Ohio have. There's unrelenting pressure to reduce cost during a time when the demands on the healthcare systems continues to grow exponentially, and there's no end in sight. You know, just last week I was reading the Bloomberg Healthcare Rankings, and it rates the United States as one of the least efficient in the world. We're number 50 on the list of 55. And although we spend more, we're more fragmented, less organized, and coordinated than many countries around the world. And that leads to this inefficiency and somewhat embarrassing result. It's not quite as embarrassing as our US presidential politics right now, but it is equally concerning. But we need to look to countries like Canada, where you spend about half as much, but you're 35 spots ahead of us in the rankings and climbing. Forums like WIN, we believe, will really help accelerate the information exchange between the two countries. The capacity to scale innovation in the health sector and increase collaboration between our countries provides boundless potential to improve patient care and outcomes and generate efficiencies to sustain our health systems both here and around the world. And WIN will be a mechanism to allow that objective research, provide a forum for knowledge exchange from all parts of the healthcare supply chain to find ways to improve care and outcomes. And in the end, that's what it's all about, making sure everyone has a chance for a longer and healthier life. So on behalf of the Advisory Council, thank you all for being here for the launch of this important work. I encourage everyone to actively engage with WIN to help build this essential capacity so our health systems can find solutions to our common challenges. And like you, I'm also very much looking forward to the release of WIN's first thought paper and hearing Dr. Snowden's groundbreaking research on the healthcare supply chain. Thank you for all being here.
Thank you, Martha, for your obvious commitment to WIN and your remarks on behalf of all of the Advisory Council members. We're very fortunate to have you involved. And also I want to acknowledge your colleague, David Murphy, who's President and CEO of Cardinal Canada, who is here today and will be having a speaking role at the formal launch of the event. It's now my great privilege to introduce someone known to many of us in this room, Mr. Dwight Duncan. Dwight, graduate of McGill and the University of Windsor, a native of Windsor. Dwight served as a Liberal member of the Legislative Assembly of Ontario, representing Windsor area ridings from 1995 to 2013. He served as Deputy Premier, Minister of Finance, Chair of Management Board of Cabinet, Minister of Energy, Chair of Cabinet, and Government House Leader in Ontario. He certainly is well known to all of us, and as someone who also certainly understood the finances of the province, Dwight was involved in many of the conversations that have stimulated the discussion about the need to find greater efficiencies in health care, and I've had the opportunity to hear him speak many times about that. He remains very busy, and he currently is the interim chairman of the Windsor-Detroit Bridge Authority, a not-for-profit Crown corporation that is responsible for the management and procurement processes for the design, construction, operation, and maintenance of the Gordie Howe International Bridge that will connect Windsor and Detroit, that will connect Canada and the United States. And his involvement in that brings to the fore also the importance of our border region and the opportunity that WIN has to build upon the expertise of Dwight and others as we try to look at health innovation, not only in Canada, but as Martha mentioned as well, how can we learn from each other what we're doing? It is a tremendous privilege for me to introduce Dwight Duncan to the podium.
Thanks very Thank you, Alan, for that very kind introduction. And, you know, before I retired from public life and went to the private sector, I used to wing my speeches, but I decided I better put notes down because I'm getting a little bit rusty. So first of all, it is a pleasure to be here to celebrate the official launch of the World Health Innovation Network. Special congratulations to Anne and her team on the launch of WIN. WIN is the first Canadian Health Innovation Center with ties to the United States. Building partnerships between our countries will ultimately advance innovation and improve, and most importantly, improve health outcomes across a broad spectrum. We have much to learn from each other. Collaboration, as envisioned by Anne, will make that happen more quickly. I'm one of those who happens to believe that Canada's health system has served us relatively well. Like health systems around the world, it is under constant stress. The need to innovate, and I would argue to disrupt, is greater today than ever. The reasons for this are well understood and widely debated. Changing demographics and technological changes are at the heart, essentially, of many of these matters. Whether privately delivered or publicly delivered, whether single-payer or multi-payer systems, the stresses are real and they're here today. I mean, this is the year the baby boom turns 70. There are challenges across a range of health services, whether you're talking about acute care, long-term care, palliative care, mental health, and preventative health, to name only the broader categories. There are inevitable conflicts between care providers and care payers, whether governments, insurance companies, or families. Of course, in the provision and delivery of health care, there are always ethical and moral questions that impact many of the policy choices we need to make. I actually believe, as I said a moment ago, that we have done a pretty good job over the last quarter century in adapting to our changing world. And this is not to suggest that things are perfect. Far from it. In some instances, there have been important choices that have changed the fundamental provision of a variety of healthcare services. Some successes that come to mind are the collection of information. It's hard to imagine. The United States was a little bit ahead of us on this, but it's hard to imagine that the Canadian Information for Health, the Canadian Centre for Health Information only came about, I think, 15 years ago now. When I was a young member of the opposition, nobody at the Ministry of the Health was projecting how many doctors we would need. And so one government actually cut first-year medical school enrollment at precisely the time they should have been increasing it. Some of the other successes that come to mind are the shift away from institutional to community-based care, the adoption of health protocols that allow for proper treatment by appropriate providers. And you know, the list is quite long. I mean, think about it. You can get a flu shot at the pharmacy now. That's 3 years old, 4 years old. In other jurisdictions in the United States, naturopaths can provide services that only medical doctors can provide here. There are all kinds of these things, and again, we can learn from each other. And sadly, there have been spectacular failures. Among these are the epidemic of childhood obesity, the slow adoption of e-health technologies, society's failure to adequately confront mental health issues. And when I spoke of disruptors, I was thinking of things like this. Called an iWatch right now. I suspect this is going to be the the entry system to the electronic health system. Governments all over have had spectacular failures on e-health. We have had them here in Ontario. They're widely reported. But those kinds of disruptive changes are going to be needed. I suspect that there is a kid in a garage somewhere in the United States that is developing an app that will detect cancer cells in your body long before what we can do today. I mean, the stuff that's here now is really quite amazing relative to what we had not that long ago. Sometimes, and I frankly, as Minister of Health and as a politician, I often felt this, Sometimes it feels like we are muddling our way through a myriad of challenges. Other times it feels like bold steps are being taken that will change our fundamental reality. And then finally, we have to confront the need to better educate the public about healthcare and its challenges. I dare say most Canadians don't realize that long-term care is mostly privately provided in this country, and that the fastest growing cost areas in healthcare in Canada are largely privately delivered. And again, none of us really wants to confront these things. You know, I used to say, when I'd give a speech when I was still in government, I'd say to the audience when they were sitting down, by the way, I'm giving you the abridged speech because I know that you're standing up. I used to say, turn to the person on your left and turn to the person on your right. One of you will be in long-term care, and one of you will develop dementia of some form. None of us wants to think about that. None of us. Many of us are living with it, whether it's parents, brothers or sisters. I mean, I see situations now where people are living so long that people who are grandparents are looking after great-grandparents. That was unimaginable. How many of you know somebody that's over 90 driving their car and still active in employment and work and life? And that's a wonderful thing, and that's one of the great advances we've had. But these are among the challenges. I dare say also that the flip side of this is that publicly delivered services are slow to adapt, underfunded, and competing against a range of other public priorities for attention. You know, when you do polling in Canada, most Canadians will identify healthcare, depending on the state of the economy. If the economy is relatively healthy, most Canadians will identify healthcare as their top concern. But most Canadians don't believe government can do anything about it. And that's why it's not what we call a ballot box issue. I shouldn't say we, I'm not a politician anymore. I guess you're always a politician, but that's why you'll hear politicians talk more about education and other things. But it's a reality that it will be at the center of our political discourse for the immediate future. I saw yesterday where Premier Clark of British Columbia has put the federal government on notice that the health funding formula that was proposed by the previous government, implemented by the previous government, is inadequate. And of course, there's always unique Canadian issues around this. You heard the story about there was a conference on elephants, and a Canadian was asked to give a paper, an American was asked to give a paper, and a Frenchman was asked to give a paper. The American's paper was entitled "The Elephant for Fun and Profit." The Frenchman's paper was entitled "The Elephant in Cuisine," and the Canadian's paper was "The Elephant, Federal or Provincial Jurisdiction." And so on top of all of the other issues that are out there for the people that run our healthcare system and do it, in my view, overall pretty well, there are all these sorts of things. And that's why I believe this World Health Innovation Network is such a welcome initiative. Whether you're dealing with broad public policy choices or the efficient functioning of the supply chain within the healthcare system, we need to constantly innovate, constantly build on our knowledge, and constantly do better. And so, Anne, and to the University of Windsor, to the Odette School, my alma mater, to the university, and of course to Anne, I join all of your friends and colleagues in wishing you the very best as you begin what I think is an extraordinarily important initiative, one that will not only contribute to better health outcomes, but allow us to have better insight to what works in other places as opposed to what we ourselves do alone. So thank you for having me, and all the very, very best as you begin this extraordinarily important initiative.
Thank you very much, Dwight. You touched a lot of nerves in the room, certainly for me. I have a brother at the leading edge of the baby boom and a brother at the bleeding edge of the baby boom. I'm somewhere in between. But still, I think everyone in this room is very aware of that issue. I also want to say that Dwight mentioned the medical schools, and it was Dwight's urging and efforts that resulted in a medical school at the University of Windsor in partnership with Western University in London. And very early on, I remember Dwight saying to me that, every day there's 3,000 people who cross the border from Windsor into the United States to work in the healthcare system. So we have a very large sample size of people who have direct experience that we can draw upon to help us in this effort. It's now my privilege as well to introduce the new Acting Dean of the Odette School of Business, Dr. Mitch Fields, former Executive Director of Co-op Career and Employment Services at the University of Windsor, and prior to assuming that, he was responsible for the startup and served as the first Executive Director for the Center for Executive Education, which is an organization at the University of Windsor that has really reached out internationally to attract students, and it's one of the reasons why our international reach today is what it is. He's taught at 6 universities in Canada, the US, and Australia. He received his PhD from Wayne State University and has published research in many journals. He has extensive international consulting experience in executive education, employee surveys, and management. He is the recipient of teaching awards and has been very actively involved in the community on various boards. Please join me in welcoming Dr. Fields. Mitch.
Thank you for that introduction, Alan. When you were making the introduction, I didn't even realize it was me you were talking about. First of all, Anne got her wish. Anne wanted a standing room only crowd. I now know if I want a standing room only crowd, don't put chairs in the room. Anyway, oops. I'm delighted to be here today, and I'm delighted to be here for the launch of WIN. WIN is very exciting. And as a dean of a business school, someone might ask you, what is WIN doing in a business school? But if you think about it, what do we teach in business? We teach things like strategy. We teach things like budget. We teach things like customer service. And if you look at people in the public sector or the private sector, what do you struggle over? You're struggling over budgets. You're struggling over service delivery. You're struggling, and I know everyone in this room struggles with human resources issues. These are things that we teach in business that are applicable to any industry, not necessarily just what I'll call the for-profit sector. So Odette is delighted to have WIN as part of our family. The other thing, when I look at this room, I'm going to be a little shameless in my self-promotion. When I look at this room, I see parents. And when I see parents, what do I think of? I think maybe some of you have university-age children. I think Dr. Wilderman and I both would be delighted if you'd consider University of Windsor as a place to send your children, especially the Odette School of Business. At the Odette School of Business, we pride ourselves on our outreach to the community. We pride ourselves on developing graduates that are grounded. I like to say what's our distinguishing feature is our students are not afraid to roll up their sleeves. They actually will work the copy machine. The other thing about WIN, because WIN does involve an international focus, that's very important to me as a dean. It's very important to me as a person. As Dr. Wilderman said, my education is in the United States. I grew up as an American, and I'm now a Canadian. I like to see cross-border initiatives. I just hope someone doesn't build a wall across that border. But I have to tell you, ultimately, I do think common sense is going to win out. I do think we'll have a good election, and I do think the leadership in place is going to be driving both countries to cooperate, and I'm optimistic, despite what you might see on CNN. But in all seriousness, Anne, where's Anne? Anne, I just want to congratulate you. Anne is a faculty member at Odette, again, business school, health initiatives. I think Anne has done a tremendous job, so I really want to congratulate you, Anne, on everything you've done. So I want a big round of applause for Anne. I also want to acknowledge my predecessor, Dr. Alan Conway. Alan was really one of the movers and shakers behind bringing WIN into the business school, and I inherited a wonderful function. So Alan's over here. Alan, congratulations. Thank you. I also want to congratulate the previous speakers and thank them very much for their support. Again, I'm just flattered as Odette to have an initiative like WIN as part of our team, looking to the future. I think this is going to be great, and we're really going to do some very exciting things, as you've heard already. So again, thank you to the previous speakers. I also want to thank everyone for coming out today. Look at this audience. This is really great. On a Monday, and I know everyone here is involved in other occupations, other things, businesses, healthcare, and I want to thank all of you for coming out because I think it's tremendous. So thank you all very much. I now get to do one of the more exciting things of the day. I get to make a toast. The only thing is, it's only sparkling water, folks. I think, let me try it. No, it is. It's only sparkling water. But what I want to do is I really want to make a toast. I want to make a toast to Anne, her team, all of our supporters that are here today, and I want to thank you all very much. I want to wish it the best of luck. In my tradition, when we make a toast, we say l'chaim. I think l'chaim is very appropriate because the interpretation of l'chaim, the translation is to life. What a better way to start the World Health Innovation Network than saying l'chaim. So to life, l'chaim. And we look forward to great things. And I think what we have to do now, in closing, is we have to be moving on to the next event, which is going to be the launch of Anne's first thought piece, which is going to take place in another part of the hotel. So if you're going out the door, you look for the people in the blue shirts, and they'll be telling you where to go. So without further ado, I'll call this meeting closed. And again, thank you all for coming out, and best luck, WIN, congratulations. Thank you.